and colorectal surgeon at Cedar Sinai Hospital. Dr. Zuri Murrell is with me now to talk more about this. Doc, it's good to see you again, and good evening to you.
Good evening to you also. And first and foremost, I just want to say my thoughts and prayers are with our brothers and sisters in Louisiana and other issues. And I appreciate you for having me on. I know a lot of us feel that with everything going on in our world, we don't have control of a lot of things. But I want to tell you that we do have a lot of control over this particular disease. As you previously mentioned, African Americans are 20% more likely than our Caucasian counterparts to be diagnosed with colorectal cancer, 40% more likely to die from it. And there's many reasons for this, but a lot of these deaths can be prevented by us being proactive.
hmm And Dr. Murrell, just over a year ago, you and I actually spoke about this, about the late great Chadwick Boseman passing away from colon cancer. Now Real Housewives of Atlanta star's husband, Greg Leakes. Of course, we know that more than just celebrities are dying from this. Why is it that it's killing our Black men so frequently?
Well, this is multifactorial. So, number one, African American men and women have the same chance of getting colorectal cancer, and that is very high, higher than our other counterparts. And part of it is it's all multifactorial. Number one is socioeconomic status, in terms of also having health care that is not only um, available but adequate health care. And number three is really prevention. Colorectal cancer can be prevented by a test called a colonoscopy. Now, this colonoscopy, can scare a lot of people, but also for African Americans, a lot of times it's not offered to us at the same rate that it is our white counterparts. And so I implore everyone listening is you have to be your own healthcare advocate. What does that mean? One of the biggest risk factors for getting colorectal cancer is eating a diet that is high in red meat and eating a diet that's high in fried foods, barbecue foods, and broiled foods. Red meat in and of itself is a carcinogen. Moreover, we need about 20 to 25 grams of fiber in order for us to eliminate properly, along with 8 ounce glasses of water. And let me tell you where the hope is. So when you look at African Americans, yes, we have one of the highest rates of colorectal cancer in the world. But do you know where two of the lowest rates are? Uganda and Nigeria. And so the reason for this is, there's hardly anything that separates our genetic makeup from a Caucasian person,
Right.
let alone anything that almost separates our genetic makeup from an African, okay, as an African American. Yet colorectal cancer in Uganda is almost unheard of. And the reason we believe is, number one, there's a lower rate of obesity there. There's very little red meat consumption, and they eat a diet high in fruits, vegetables, and fiber. Now, something since the last time we talked that I think is a huge breakthrough is looking at the epigenetics. We're starting to realize that a lot of colon cancer is dependent on race, the location of the colon, okay? So we have the right side of the colon and the left side of the colon. And it's important to realize that a colonoscopy is the only test that can actually go to the right side of a colon. Okay, we think that the African American colon on the right side ages quicker than a Caucasian colon on the right side, whereas for Caucasians, the left side ages quicker than the right. Now,
Wow.
this is important because a lot of the initial screening tests that we were using would be something called a flexible sigmoidoscope, which only looks at the left side of the colon. But most of our tumors and polyps are on the right side of the colon. I always say that a colonoscopy is not done to find cancer. It's the only test a man or woman can have that actually prevents cancer. This is because all colorectal cancer starts as these little growths called a polyp.
hmm
Excuse me. And you take the polyp out during the colonoscopy, and thus you prevent colorectal cancer.
Yeah, and you actually had your own experience with this, your father and your grandfather. Tell us
Yeah.
about that.
Yeah, so it's important to know your family history, and I think that that's something that a lot of times eludes us. We really have to talk to our kids, and we have to talk to each other about that. I always say colorectal cancer can be talked about at the dinner table, and people are always sometimes disgusted by that. And I always tell people you shouldn't die from fear, and you shouldn't die from embarrassment.
Right.
My father, I had to urge to get a colonoscopy, and when he finally got that test, 4 polyps were found in my father. All these polyps were removed, and subsequent tests has shown more polyps. Now, because he talked to me about this, I got my colonoscopy at age 42. I'm 47 now. I usually make a joke saying it was really hard to do my own colonoscopy, but I did not do my own colonoscopy.
Mhm.
However, because I knew my family history, at age 42, I was found to have a 2 centimeter polyp on the right side of my colon, and that was able to be removed during the colonoscopy. And I would have had colorectal cancer if that wasn't the case. Immediately after that, I really started practicing what I preach. I cut out red meat, where I only eat red meat about once every 2 months. I increase my fiber. I actually take vitamin D, something that a lot of us, especially as African Americans, we're deficient in vitamin D. Vitamin D can be found in gummies now. You can take them in gummies, you can take them in pills. You can find vitamin D everywhere. And vitamin D helps to decrease our polyp growth. Vitamin D is converted, we convert vitamin D from our skin. And as an African American, you have to be in the sun a little bit longer than our white counterparts for this to happen. Well, guess what's happened during COVID? Nobody's going outside. So our vitamin D levels are at an all-time low, and this definitely can increase our risk for colorectal cancer. And the reason I'm actually so passionate about this is because this is something we can control, but we have to know the facts. We have to be prepared for our doctor's appointments. And, we're a team. I always tell my patients we're a team. So as a teammate, I need to listen to my patients, but also I want my patients to be prepared for our appointments. And so whether we're talking about colorectal cancer, diabetes, high blood pressure, patients need to come in, have a list of questions that they need answered, and kind of develop a plan together with their physician. It is so important to have a good rapport with your physician. And that means that being able to tell your physician something, but also trusting your physician enough so that you'll do a test that you may find uncomfortable, but is necessary. One of the biggest factors of why we die from colorectal cancer is a lot of African Americans report never being offered a colonoscopy by their doctor. And also, a lot of times, if a doctor is not as comfortable with the African American patient, and a patient says, look, doc, I don't want anybody sticking a scope there, then when that happens to me and my patients tell me that, I say, look, do you love yourself? They'll say, yeah, but I had a full life. I say, do you love your wife? They'll say, well, yeah, but she'll be okay without me. But then I say, do you love your kids? And they say, of course I love my kids. I said, well, your colonoscopy can save your children's life. My dad saved my life because he got his. I knew to get mine, or else I would be having a totally different conversation. And so I implore everybody, we can take control by what we put in our bodies by getting a colonoscopy starting at age 45. Starting at age 45, that's screening, meaning you have no signs, no symptoms. We start at age 45 with a colonoscopy. I don't want a stool test that shows cancer. I don't want any of these other ways. You need a colonoscopy first because all those at-home kits cannot find a polyp. And once again, a colonoscopy is done basically to remove polyps, not to find cancer. And that's so important. Also, obesity. One of the reasons we've seen a 12-fold increase in millennials now, and young people, which means younger than age 50 getting colorectal cancer, is obesity. Obesity affects almost every cancer, every part of our life. It is very hard. It's a pandemic. And now we know that about 2/3 of millennials will be obese by the age of 40. And so that's the hardest thing to get patients to do. But is to try to lose weight. But there's so many options for that now. And that is something that I hope you have me back to discuss, because that's really how we make a difference in so many health issues across the board, especially for us.
Yeah, certainly. You said a lot of stuff there. I would call that preaching, if you will, Doc. So,
No, I apologize.
no, don't apologize, because our viewers need to hear all of what you're saying right now. And you said something to me distinctively last time when I spoke to you. You said when someone passes from this, it lets you know that there's still a lot of work to be done and that it didn't have to happen. If you're speaking directly to the men right now and the women, as you mentioned, those who are watching, what do you say to them?
I say, once again, the reason we're dying for this, and I always say you shouldn't die from fear and you shouldn't die from embarrassment. A lot of us are afraid to get a test, but this colonoscopy prevents cancer. A lot of us are embarrassed to talk about this. The best time to talk about colorectal cancer is at the dinner table. That's when you can make the biggest difference by what you put in your mouth, okay, and how we talk to each other. We talk to each other at the dinner table. We talk about our family history. When we eat, yeah, it's okay every once in a while to eat some of the foods that we love. Listen, I love fried chicken. It reminds me of my grandmother. It reminds me of my family outings, but you can't eat it all the time.
Right.
And most of us don't eat it all the time. But we have to remember that more than not, food is a energy for us. It's like what makes our body work. And we should basically eat to live and not live to eat. And that's something that I really want to impart. But we're in control of this disease by the tests that we get, the tests that we demand, and also what we put in our bodies.
Yeah, certainly. And so you mentioned fried chicken. I'm like, oh Lord, you said put the wing down, but I understand.
Yeah, you just can't have it every day. And something that I really applaud your network is usually I only get to discuss this in March during Colorectal Cancer Month. And the fact is that we're talking about this now really lets me know that some of the tide is turning, and we're not being embarrassed by this. I think I spoke before about my mother passed from breast cancer, and people don't even remember that breast used to be a dirty word. She wouldn't tell anybody she had this. And then
Wow.
some of the foundations, have changed that to the lexicon where there's all kinds of shirts. So I love my breasts. I save the breasts.
Hmm.
And now, prostate cancer is not a dirty word, but colorectal cancer still considered a dirty word. And I really am glad that we're trying to kind of lift the veil off this disease and just let people know it is so preventable.
Yeah, that is so important. We got to get this information out. Well, Dr. Murrell, we thank you so much for your time, and we will have
Thank
you
you.
back to bring more information to our viewers. We appreciate your time.